Dr. Rudin, you did mention this. You talked briefly about valvular heart disease. Somebody asked this question, perfect timing. Does mitral valve prolapse lead to PACs, PVCs? I like to say that most women in the 1980s were diagnosed with mitral valve prolapse whenever they went into the doctor. The doctor, put the ears on, put the stethoscope on, thought they heard a little something, heard a little mid-systolic click, and said they got mitral valve prolapse. Tell me, majority of the time, was that true?
No, we changed the criteria for mitral valve prolapse to make it more strict. That the valve has to prolapse further back into the atrium. So there's a lot of people that have a diagnosis of mitral valve prolapse that don't really have it. That's clearly true. Okay. That being said, there's a lot of people that do have PACs more commonly than PVCs, but there's certainly, if you have mitral regurgitation or leaky valve with the mitral prolapse, you have a bigger stroke volume, and that's a strain on the ventricle. So you could have PVCs as well. So both are possible, certainly.
Do you think with the prolapse, maybe there is some excess kind of tugging at that mitral annulus and maybe causing some irritability? Is that something I mean, again, there's not really much you're not going to send someone for valve repair based on that. And of course, everything we do is going to help, but that may be another mechanism.
Yeah, good point. I mean, there is something called mitral valve prolapse syndrome, that they don't have demonstrable PACs, they don't have demonstrable arrhythmia, but they feel palpitations. So kind of what you alluded to, Jack, is a reasonable explanation, among others.